Usually
Is
it says,
is Penny jumping in?
not yet.
Oh,
Well, welcome everybody for this evening's extended learning call. We've got quite a panel here this evening. We've got Katie Houle from the Department of Human Health and Human Services and Emily Barr from the department as well. And they're going to share some information about the system of care grants. Sorry, my dog's biting my toe. And then we also have Dallas Tufty here from First Link, who's going to be also sharing some information with us. So this evening we are going to record this so that we can post it on the website, and so that the department will also have a copy as well as First Link. So if there's going to be any um, after they're done presenting, if there's a lot of questions, if you're going to have a lot of personal information in there, I'll probably shut that recording off, just to make sure that the comfort level is there and we're not putting out to Zoom land all this private information. So without further ado, I'm going to ask the ladies to go ahead and get started.
all right. Well, hello there. And for those that maybe are watching this back in a recording, as Zanine shared, my name is Katie Houle. I am a clinical administrator within Health and Human Services, the Behavioral Health Division, and I specifically oversee our state's system of care grant. Um, I want to provide just a little bit of background and context, especially if the system of care grant or the work that we're doing within our Children's Behavioral Health Service Array is new to you. But just a little brief background. Our state in 2018 identified, and probably has been identifying for some time, the need to enhance and streamline a system of care for children with complex needs. And one important milestone was first and foremost to really look at some federal grant funds, and we were one of 6 states that were awarded a Substance Abuse and Mental Health Services Administration grant in the 2022 cohort. So we have federal system of care funds between 2022 and 2026. As we all know, there's a lot happening federally right now. We haven't had any indications that that funding is going to go away. So we're pushing forward in investing in our children's behavioral health work. So the two goals of the System of Care grant is, how do we fill critical gaps within our children's behavioral health continuum? We know and understand in our communities that there are significant gaps, especially as it relates to the gap between outpatient and our hospital and psychiatric residentials. We have our regional human service centers that provide really integral home and community-based services, but they only have so much capacity. And so we have a lot of work to do as it relates to having more community-based services, especially that are more intensive and frequent in nature. And the second goal is, how do we develop partnerships and infrastructure to sustain a system of care? And that's really the heart of this work for me, is because one thing that we know for children with complex needs is they cross many systems. And I think for you as parents and caregivers or advocates or those that are serving professionally in the field, we see that every day, right? We have children that have complex needs that are need educational accommodations and have school-based concerns. Maybe they're crossing into juvenile justice and child welfare. And no one system alone can provide the support that's needed. And so we've been focusing in 2 key regions. That would be our region, what we call our Region 7, which is the region that's served by West Central Human Service Center, in the shared geography with Standing Rock and MHA Nation. And then up in the Greater Devils Lake region, which is with Lake Region Human Service Center and the shared geography with Spirit Lake and Turtle Mountain. And so one of the things, just to bring context to tonight, one of the things that we has been an area of focus within our system of care initiative is looking really meaningfully within our youth crisis system. And when we think about youth crisis, there's three parts of that continuum: someone to call, someone to respond, and a safe place to seek help. And so that's one reason that Dallas is here, is because we really want to invest in the utilization of 988 and understanding that part of our crisis continuum as a supportive line to reach out for text and ways to call and seek support, but also how does 988 connect to our human service centers and the potential need for mobilization and community-based support. And so we have been doing some interesting work in what does that look like in our schools, right? How are schools and child serving professionals using 988 and using 988 as a mechanism to mobilize? A core part of this is ensuring that parents and caregivers and those that have lived and are living every day and you know, living and providing services on behalf of their children have voice in this work. And so, you know, our goal tonight is first and foremost is to share some great information about the diverse services that FirstLink provides. But if there is time and if there is interest, I'm sure Dallas could answer questions about 988, but maybe there's general conversations of strengths within our youth crisis system, key barriers. Maybe if people are open, individuals might have some lived experience that they want to share. I think we're just going to see where it goes. And so that was probably broader context than I had planned, Emily, but a key part of our system of care work is shared leadership. And what I mean by that is I am not an individual with lived experience parenting a child with behavioral health needs. My background is more clinical and professional. So it's really important that I share leadership with Emily because Emily is a parent with lived experience. And I think our ability to partner and make sure that we're doing clinical best practice, but also making sure that the work is family driven is really important. And so with that, I will pass it to you, Emily.
Perfect. So like Katie said, shared leadership within our system of care grant, it's actually a grant requirement that the lead family administrator has lived experience navigating child serving systems on behalf of their kids. And so a little bit about me is I do have a social work background, but my primary experience has been in raising my kids. And so my husband and I have 5 children. 2 biological and 3 that we've adopted from foster care. And so they are full siblings and have a variety of mental health, behavioral health challenges. I like to say that it's a brain-based disability, and so it's something that will navigate across the span of their life. And so crisis is something that we have faced in the last couple of years. And I did look today to see when 988 came out and was like a thing. And I think if Google was correct, it came out in 2022. So Dallas, I don't know if that's correct or not, but that's what I found on the internet. And so there's a couple instances between now and 2022 that I can think of that we could have utilized the crisis line to call. But until I came into this position, I did not know really that was a resource that as a parent I could use. Of course, I think I have seen signage out in the community, but not something that I ever felt was applicable to us. And so I think this has been a really big learning process for me as well. But knowing that it exists and knowing that it's out there, I think both Katie and I are really want to ensure that not only professionals in our communities know, but that parents and caregivers know what 988 is. And I think it's it's one thing to see it on a flyer or for a professional to tell you about it. It's another thing to sit in a space and have like firsthand account of what the service actually is and how it can be a resource or support for you and your family. So with that, I will pass it to you, Dallas, to give us some necessary education on what 988 is and how families like mine can utilize that.
Awesome. Thank you so much. Yeah. So it was the National Suicide Prevention Lifeline prior to 2022, and then it switched to 988. So it was a 10-digit phone number. And then for the ease of access during a crisis or just general like remembering, they condensed it to the 3-digit of 988, which is amazing because when you're in a crisis, you're not going to remember a 1-800 phone number. And so yes, 988 has been a valuable shift in that. So I'm going to go ahead and share my PowerPoint quick, and then get that pulled up to walk through um, meeting FirstLink. So I'll talk through who FirstLink is just to get a bit more context of why I'm here and why we're talking about this and how you can reach us both from the 211 helpline but also the 988 line. And then I'll talk specifically about what goes on a 988 call and kind of some more context on those interactions. So first, I want to start by explaining what FirstLink's mission and vision are. So FirstLink's mission is to assist people in identifying, accessing, and making effective use of community and volunteer resources. And we want to do that through being that first link in connecting people and those resources 24 hours a day. All of our services over the phone are 24/7. If there's any sort of inclement weather coming up, we make a plan to make sure that we're always there to support those in our communities. So on this slide, I just have a general overview of our services. So again, those top two on this slide, the 211 helpline and the 988 suicide and crisis lifeline, those are our primary foundations for this agency. And then the bottom three complement and support the work that we do on 211 and 988. So 211 is a information and referral helpline for information on community resources. And then we here at FirstLink are also able to provide non-judgmental listening and support on that line. The 988 Suicide and Crisis Lifeline, of course, is there to offer support and crisis intervention when individuals are experiencing a mental health challenge or a substance use challenge, or concerned about a friend or family member, somebody else in their life who may be experiencing those challenges. We also answer some different contract lines through some different human service agencies. A lot of those are after hours, like Katie was talking about the human service centers across the state. We at FirstLink answer those phone calls after the human service center business hours are over. Those calls get transferred to FirstLink, and our call specialists handle it from there. Just as an example of one of those contract lines. We also have a care and support program where we provide ongoing support to individuals in need. We reach out once a week or every other week to provide ongoing support to individuals who are either discharged from partner facilities or who are referred to us from our 211 helpline or 988 helpline internally. And then we also provide different mental health education, so spreading awareness and education of mental health and suicide to the communities that we serve. So here is a quick little comparison between 211 and 988. We here at FirstLink answer both 211 and 988. So we're able to do similar things on either phone line just because all call specialists are trained to do the same thing, but they are two different helplines. And so we just like to highlight that there is a difference in terms of what the expectations kind of are for each of those phone lines. So for 211, our service area is the state of North Dakota and Clay County, Minnesota. That's the 988 line ringing right now, if you can hear it. So for 211, we answer for the state of North Dakota and Clay County, Minnesota. Again, that primary purpose is to offer resource information and give those referrals for resources. So there's a potential for a hold time because we here at FirstLink are the only call center for the state of North Dakota and Clay County, Minnesota for 211. It's a nationwide program, but each state has kind of their own individual call centers. There's not a network of call centers. On the other side, 988, there is a nationwide network of call centers. So for the state of North Dakota and 17 counties in Minnesota, FirstLink is that call center for those phone calls. And then we answer text and chat statewide for North Dakota and Minnesota. So a large array of area that we cover for 988. And again, because that primary purpose is that crisis intervention and safety planning when individuals are having thoughts of suicide or are concerned about somebody who may have thoughts of suicide, no call is going to go unanswered, and nobody's going to be sitting in a hold queue for an extended period of time. We at FirstLink, when it rings to us, I'm sure as you heard, it rings to all of the phones in our call center and all of the phones that are connected to our phone lines to give everybody an opportunity to answer that call. If nobody is able to answer that call here at FirstLink, it will get routed to a backup center. So that call will get answered within about a minute of that person making that phone call after the automated greeting. And so we just like to highlight the fact that you're not going to be waiting in a queue for an extended period of time. If nobody at FirstLink can answer that call, it'll go to the backup center and then somebody will answer and be there to support and provide that crisis intervention and get somebody in a place where they're able to stay safe for now. Again, all of our phone lines here at FirstLink are available 24/7, 365 days a year. They're going to be confidential. We're not going to expose anybody's information unless there's imminent risk of harm to self or others. Of course, we have to report those situations and get people connected to emergency services, but it's few and far between that we do that. And again, that's in life-preserving situations. And then again, we're providing non-judgmental listening and support regardless of whatever phone line somebody contacts us on. So a little bit more information on the 211 helpline, just because it is so valuable for those community resources. Access to resources can help reduce that stress and strain that may lead to the development of a mental health challenge or suicide challenge. So you can reach 211. You can reach FirstLink by dialing 211 if you're in our service area, or you can dial 701-235-7335. That 10-digit phone number is just the direct phone number to get to FirstLink. You can also text your zip code to 898-211 if you're interested in texting as opposed to making a phone call. And then you can also access our resources on our website at myfirstlink.org. There's a spot on our homepage that says search for resources. And from there, it'll take you to a community directory where you can then search for those resources on your own. If you're not able to make a phone call or send a text message or just want to take the time to explore those on your own, we want to provide our resource information in whatever way is the most accessible for those who are in need. All of the information you would find in that community directory is the same information that somebody would share with you over a phone or text conversation. So again, information on community resources is what we can provide. We're going to ask some eligibility questions and explore those needs to be able to provide any referrals that are appropriate for an individual. We're providing that supportive listening, and then in some cases, we do the intake for some certain programs. And then moving on to 988. So kind of the rest of this is going to be kind of more focused on 988, but to reach 988, you can either dial or text 988. You don't have to text anything specific to the 988 number. You can text, hello, I need help. You can text a bit about the situation that's going on, and the call specialist will be able to see that and respond appropriately. The 1-800-273-8255 National Suicide Prevention Lifeline is still in service. So if that's a phone number that somebody has saved in their phone, or if it's a phone number they've memorized, or if there's materials that somebody has that still has that phone number, it is still in service. So individuals can still call that, and it just routes to the 988 line at this point. So multiple ways of connecting in that way. There's also an option to chat online at 988lifeline.org/chat. we have a lot of young folks who chat in during school hours from their personal devices like their tablets or their phones, and they're able to get support during the school day in that way. And so having those multiple methods of connecting for that help and for that assistance is incredibly valuable for those who are unable to make those phone calls. You know, if a student is at school, but they need that emotional support and they're not sure um, how to talk to the adults in their school about things, by reaching out to 988, we are able to kind of provide some of that information and really encourage them to reach out to one of the adults that's available. We're going to be providing, of course, non-judgmental listening and support. It's going to be confidential, and we're going to encourage appropriate professional care. So in, young folks situations, we're going to encourage them to talk to an adult or the school counselor, somebody that they trust in their life. For older individuals, like adults, we encourage them to reach out to their primary care doctor, or we can provide referrals to therapy or counseling services that are available in the area. We're also trained in crisis intervention, so the call specialists are going to assess the risk and create a safety plan, de-escalating that mental health or suicide crisis. Again, just trying to find those strengths within that individual and get them to a place of staying safe for now. We can also provide assistance during third-party concerns, and I'll go a little bit in depth in those in the next slide, but we can do a concern for another call. We can provide referrals for resources on behalf of a third party, and then we can also do communication coaching. And then 988 also has some different specialty lines that are included in that initial automated greeting. So if individuals press 2, they can get connected to the Spanish speaking line. If they press 1, they can get connected to the Veterans Crisis line. And then if they press 3, they can get connected to a line that's specialized for individuals who are LGBTQ youth or young adults. We at FirstLink don't answer these specialty lines, though we can still support individuals who do fall within these demographics. And if somebody speaks a language other than Spanish or English, we have access to an interpreter line where we can connect to an interpreter with over 240 different languages, I believe. So if somebody speaks another language, we can still provide that support and make sure that that person is able to communicate, again, in the way that works best for them. Okay, and then on this slide, I just have some different reasons to contact, because that's kind of a question that we get pretty often. People assume you have to have thoughts of suicide to call 988, but there's many different reasons to call. Of course, if somebody's having their own personal thoughts of suicide, it would be great to reach out, either text, call, or chat. We can provide that non-judgmental listening and support and connect with professional supports. If somebody's having thoughts of harming others as well, we can be there to de-escalate that situation, support that individual during that time, get them connected with professional supports. If somebody is experiencing some personal substance use concerns, we can get some, treatment options provided if they're interested. Otherwise, we can just be that listening ear and support them in whatever way they need. And then this is where I'll kind of go a little bit more in depth about that concern for another, how we can help during those times. So if you are concerned about a friend, a family member, or a coworker, whoever is in your life, related to any of those previous 3, or just in general, they seem to be having a difficult time, we can help you to support that person. So a couple different options. One thing is communication coaching. So we can have a conversation about mental health, kind of explore how to address your concerns in a way that's appropriate, gain comfort in asking about suicide or mental health in general. And we can also do resource sharing. So if you know that your friend is kind of struggling with their rent and their utilities, and that financial weight is just adding to the general stressors in their life, and they're maybe thinking about suicide because they're also having those financial concerns, we can find some of those resources that might be able to help lessen some of that financial burden. So that way you can share those with your friend. And then even if you're not, in a place where you want to talk about that mental health, by reducing that, financial burden, that can lighten some of that weight on their shoulders. And then just making sure that you remind them that, you're there to listen if they need that support, or, encouraging them to contact 988 if they need any additional supports. And then we can also do a third party call. So if you contact us and you're really concerned about somebody, but you think somebody needs to have a conversation about what's going on, but you don't know how to do that, and you're not really sure you're the best person to do that, we at FirstLink can do something called that third party call. We'll collect your name and phone number, and then your friend's name and phone number, and then, we'll explore some of what you believe is kind of going on, some of the reasons why you think that they may be struggling, all of those different things that are relevant. When we have all that information, we'll let you know. We're going to go reach out to your friend. We'll call them 2 times in a row. If we get a hold of them, we're not going to call you back and we're just going to focus on talking to your friend. If we don't get a hold of your friend, we will call you back. And then that time we'll explore those other ways to assist, whether that be communication, coaching, resource sharing, or kind of whatever else may be appropriate. But if we do get a hold of that friend, we'll just identify ourselves by saying something along the lines of, my name is Dallas. I work with the 988 Suicide and Crisis Lifeline. Somebody in the community reached out to us and is concerned about you. And I just want to give you the opportunity to talk about whatever might be going on. We're not going to tell the person who called on their behalf, for the sake of confidentiality and safety. We want to make sure that that's separated. Even if they guess who it was, we're not going to say yes or no. We're just going to say that we can't share that information. And then we're just going to give the floor to that person who might be, going through that mental health struggle. Just open up the floor for them to share about anything that they would like to. Sometimes people don't want to talk, and that's okay. We just remind them that 988 is there 24/7 if they ever do want to talk. And other times people really open up about whatever's going on. So having that option to be that third party call is really beneficial, especially if you don't feel you're the most appropriate person to have that conversation. And then another reason to contact 988 is if you're just having some general mental health struggles. So if you're having a really bad day, or if the weight of life has just kind of been stacking up and you have a lot of those general stressors that are just kind of starting to really wear on you, if you have a situation where, you want to talk about it, but you don't know who in your life you can talk to about whatever's going on, we're there for that. The best time to talk about a hard time is before it reaches that crisis. So by talking to somebody before you reach that crisis, getting connected to, services, or even just having that support and that emotional connection at that time can really help a lot. And so we just encourage anybody to call if they ever need somebody to talk to. We're there for that. So what happens when you actually make that phone call? What happens when you dial 988 and you press talk? So initially you're going to hear an automated greeting with the options to select if they apply. So 2 for the Spanish speaking line, 1 for the Veterans Crisis line, or 3 for the LGBTQ plus or young adult line. And then you can also just press 0 to bypass that whole thing. So if you just want to get connected to a call specialist right away, as soon as you dial 988 and it starts making that automated greeting, if you press 0, it'll skip all that and get you ringing to us. So we encourage people to do that, especially if it's in a situation where you can't wait 30 seconds and you need to talk to somebody as soon as possible, because that automated greeting can last about 30 seconds. After that 30-second initial greeting, the phone will start ringing and somebody will answer that phone call. So at FirstLink, we just introduce ourselves. We say 988 Suicide and Crisis Lifeline. My name is Dallas. And from there, the conversation kind of grows. Sometimes people need an opening question or just kind of a little bit of a nudge to get the conversation going. But once we get that conversation going, we're going to listen. We're going to be there to provide that support and offer whatever help that person needs. If they just need somebody to listen to them, we'll be that listening ear. If they need help with that crisis intervention or safety planning, we're going to do that for them. If they need resources, we're going to find those resources. We're meeting those individuals where they're at and supporting them with whatever they need. After we've gotten through those initial needs, gotten that person safety planned and in a state of de-escalation, they're able to stay safe for now, we're going to provide some sort of follow-up. Oftentimes, that's to provide that care and support program where we make those ongoing phone calls. We do our initial follow-up about 24 hours after that initial call to us. And then from there, we'll offer those ongoing calls. We also may offer to do a quality assurance call. If we provide a few different resources, we want to reach out to you again and make sure that the resources that we provided were appropriate and you got that help. And if we didn't provide appropriate resources, or if the resources that we provided weren't able to help, we want to explore other options. And we don't want to put the burden of you having to reach out to us again. We want to reach out to you to make sure that you have that support. And so like that's just the general flow of a lot of our calls. Of course, each call, each contact's going to be a little bit different, but that's kind of what you can expect when you make a phone call to 988. I just want to highlight some of the important aspects of a safety plan, just because a lot of times it can be difficult to really kind of concrete what is a safety plan. It's kind of it sounds like a broad topic, but these are the general things that we will go through. Some things we'll explicitly ask, and other things just kind of come up during that conversation. So we want to explore warning signs, so thoughts, images, moods, behaviors that indicate that a crisis is developing. We're going to identify some internal coping skills and coping strategies. So things that can kind of serve as a distraction or just bring a bit of peace. So things like hobbies, going for a walk, things like that. We also want to explore people and social settings that can serve to distract. So places that you can go or people that you can reach out to that provide distraction, a bit of an escape, removing yourself from a potentially unsafe or unsettled situation. We also want to identify people that you can turn to for help. So people who are trusted and safe. People who are serving as that distraction might be kind of more of those like surface level friends. And then those people that you turn to for help, they can be people for distraction as well. But these people that you can turn to for help are the ones that you are, intimately connected with, like your mom. If you can share with your mom anything that's going on, we want to make sure that your mom is on that part of the safety plan. We also want to identify professionals or agencies that can be contacted. So identifying your primary care doctor, any nearby emergency rooms, identifying what mobile crisis teams may be available or crisis stabilization locations, and then crisis lines such as 988, just to make sure that if nothing else on that safety plan is working, you have those options to turn to when you have nothing else. If nobody is answering their phone calls, all of the places that you would go to distract are closed for now. We want to make sure that you still have those emotional supports through something like a crisis line or mobile crisis. And then we also want to explore ways to make the environment safe. That could be removing access to lethal means, removing access to substances, removing access to things that can be used for non-suicidal self-injury, whatever things are in the environment that are kind of on the unsafe side, we want to remove those or create safe access to those. And we'll explore those ways during that phone call. And always we want to explore the least invasive options first. A lot of people are concerned that if they call 988, if they call 211, and they say that they're having thoughts of suicide, that, the first thing we're going to do is we're going to call 911, or we're going to send the police, or we're going to call their mom or their dad, if they're a young person. But really, we don't want to do that. We want to explore the least invasive options first, because oftentimes those higher escalated things like calling the police aren't necessarily the most appropriate for what somebody needs in that situation. So one of the options that we can explore is doing a safety check. So if an individual isn't able to agree to safety long term, but they feel like they can stay safe while they watch a movie or take a nap or go for a walk, something short, we typically stay within 1 to 3 hours. We can do that. It's where what we'll do is we'll take that person's name, phone number, and address down, and we'll contact the caller at an agreed upon time. So if somebody says, I don't know if I can stay safe for the rest of the night, but I'm feeling okay right now. I'm going to watch a movie. It's about an hour and a half long, so call me at 10 p.m. We'll take down that information and we'll make sure that that contact knows, that caller knows, that if when we call them at 10 p.m. and they don't answer the phone, we'll call them 2 times in a row. If they don't answer the phone call, we will be sending emergency services, just because we only use that safety check in those times when that person isn't able to agree to be safe for more than those couple hours. And so just to err on that side of caution, we want to make sure that that person receives that support if, something did happen in that 1 to 3 hour period. And that person will know that, the caller will know that, and they agree to that being an option. And so when, that hour and a half passes, we'll call that person. If we get a hold of them, and most of the time we do, we will then just continue that conversation from there. We'll check in, see how they're feeling, explore other coping options, explore how they're what needs they may have, and just kind of take that call as a new phone call. Another option is to connect with the human service centers. So across the state of North Dakota, there's the 8 human service centers, and they have different crisis services like crisis stabilization units or mobile crisis teams. So we at FirstLink, if it's after hours, we can easily connect with the on-call that's available. Otherwise, if it's during business hours, we can get them connected to the crisis team, and they can provide that in-person crisis intervention, or that individual is able to make it to that open access clinic. We encourage them to go there if they need that in-person immediate support, and like a phone call is just not quite what they need. We really encourage those individuals to get connected in that way. And then we also have that care and support program. So it's that follow-up program. So if a caller expresses thoughts of suicide on a 988 call, if we are able to, we will always offer that care and support program. There are definitely times when somebody disconnects the call before we're able to offer that, but we try to make sure that that's one of our priorities. And so after that initial contact, we'll reach out 24 to 72 hours after that call to 988. And then we'll check in on that caller. We have a list of some questions that we just ask as that initial check-in, and then we offer to do that weekly or bi-weekly check-in just to continue that support for that individual. We can remind them of different appointments that they may have coming up, explore their safety plan, help them to change that safety plan as needed, encourage them to reach out to those professionals, just be that ongoing support during those times where they may be less support in their life. And then we just really like to highlight some of our statistics at FirstLink. So in 2024, we had nearly 87,000 contacts, just 3 shy. And that was across all of our different phone lines. So 211, 988, our care and support program, all contact lines. And then of 988 specific contacts, we had over 15,000 contacts. And that's a 68% increase from the previous year. Every year, our contacts as a whole just kind of seem to grow generally, but especially 988. 988 grows pretty significantly each year. And it's nice to see that more people are reaching out for help. We don't want to necessarily think of it as more people are having those thoughts of suicide or mental health crises. It's a pretty standard number of people who are experiencing that. There's just more people who are reaching out for help. And then just below that, our involuntary emergency service intervention. So those are the number of times that we have sent emergency services without the consent of an individual. And across all of our phone calls, across all contacts, that was 86,997 times or 90 calls. We only sent emergency services involuntarily 112 times. And that just really goes to show that we're exploring those least invasive options before we're breaking that confidentiality. Our team is really great at de-escalating here at FirstLink. We have a really high de-escalation rate where we're able to reach that agreement for safety, get that person connected to other services or other supports in their life, and get them to a point where they're able to stay safe for now. And if they're not, they know that they can reach out again to provide more of that support from us. So again, we just really like to highlight that it's highly unlikely that we would be calling emergency services without an individual's consent. And in the times that we do, it's truly in those life preservation times. And then we just want to highlight some of the mental health education opportunities that we have here at FirstLink in case anybody is interested in, furthering their alertness and awareness for mental health and suicide challenges and crises. And so here's just a general overview of many of our different trainings that we provide. So if you're interested in any of these, just check out our website under our upcoming trainings, and we may have something available coming up. All right, so that is all that I have for, talking about what happens when you call 988. So I will go ahead and stop sharing my screen. And if there's any questions or anything, I'm more than happy to answer.
Anyone have any questions at all for Dallas? Thanks, Dallas. That was a wealth of information.
Yeah, This is Vicki Peterson. So I'm a consultant for Family Voices, but I work with a lot of families who have children and youth with mental health and behavioral health. So I have a couple of questions, and I don't know if they're just directed for you or Katie or um, is Emily, right? Yeah, I think I
That's
know you.
correct.
Yeah. So when you talked about those like involuntary calls and then the other ones, like, do you keep track of your repeat calls?
So we do keep records of our calls, but we only access those in times when we have to. And so um if we were to be subpoenaed, then we would access those call records. But ultimately, once that call is done, that call record is submitted. Nobody should be going back and rereading any of that information that's there, just to preserve the confidentiality and the
Hmm.
privacy of our callers.
Okay.
Hmm.
Okay. That makes sense to me.
Hmm.
That's good, I think, as well. So
Yeah.
I was just wondering about that. Um, I don't know. I'll let somebody else go, but if nobody else goes, I have another question.
Did anybody else have a question? Go ahead, Vicky.
Okay. This might be for you, Katie. I'm not sure, but maybe for all of you. But these grants, and what they're supposed to be doing for the communities and stuff. I had a couple of questions. Like you have like Renew Ed, right? That's under yours. Okay. And in the schools, are you working with anything to do more intensive outpatient therapy? Like I know CHI is going to be opening up their partial hospitalization, but so many of them have closed in the state. Or what do your like crisis beds, crisis utilizations and stuff look like for young kids?
Yeah, I can speak to that. So one point of clarification, so none of our system of care funds are going towards First Link. I just want to say that. Our division does have a contract. There are some federal funds. We do have we have 19 system of care service grantees, Vicky. That does include funds that are going into Mandan Public Schools, Bismarck Public Schools, some work that's going on in Renew Ed. We did release a request for proposals last February, actually, to see if we could lift a child and adolescent partial hospitalization program in one or both of the system of care regions. And we were really excited that CHI St. Alexis Health was, I guess, at a state of readiness. And so we are supporting the opening of that partial hospitalization program. You probably know this already, Vicki, but we're excited that the partial hospitalization program is going to be opening the week of April 7th. So that is coming up soon. And I agree with you, Vicki. I think we've made this point of connection before, but I used to work at CHI St. Alexis
Yep.
Hospital on inpatient
Yeah.
care. And my dream when I was there, I was like, if only we had a partial hospitalization program. Isn't it great to see that through fruition? Some other things that we're sort of surging funding into is we do have funds that are going into the Human Service Center to lift and implement functional family therapy. And that is a Title IV prevention program. So there are some sustainable federal dollars to lift and sustain that. That's an intensive evidence-based family-based therapy for ages, I think they're accepting 11, but 11 to 17. Some other areas we have invested in funds has been into the expansion of community options, family checkup and everyday parenting, 1959, and targeted case management. And what I would say, Vicki, just to be open and candid, is I think that we're doing a good job right now in investing in categorical services. But I think the
Okay.
heart of system of care work is that we haven't made our system easier to navigate, right? Like I think
Cool.
we could be, at risk to making it more complex or deepening those silos if we don't consider what are those referral pathways, what are the ways that families are entering that system, and how can we get them better connected to services. We are, and I know that this has been a conversation for some time, but we are using some system of care funds. We have a contract with University of Connecticut and National Wraparound Implementation Center, really to see what we need to do to reform our system to reintroduce high fidelity wraparound back into our children's behavioral health service array. Because in a lot of ways, I think that that's a core component that's missing, right?
Right.
Is sort of how I started this. Is we don't have one entity that is pulling all of those natural and professional supports together to ensure that we're following the youth and families vision, that we're all reinforcing the same plan. And so I think that there's a lot of good things happening, but I'm also really open to your feedback of what you're seeing and feeling in the field. I'd be really interested in your feedback too, as it relates to 988 and youth crisis. Because, for example, in Bismarck-Mandan, 988 is being utilized by children and adolescents. It's being used by third parties on behalf of their children. But the utilization is relatively low when we consider the prevalence rates of behavioral health crisis, right? And so we have a working group that's made up of, the hospital and YouthWorks and Police Youth Bureau and the school districts. And when we started talking about, well, what are the calls that you all are getting as child serving professionals and system partners? They were well above anything that was going to 988, right? And a lot of that makes sense, right? I think that the youth system is different, right? We're going to call people that we know and trust first and foremost for support. And I think the other thing that's really missing from education from child serving professionals and I think parents as well is that 988 is the mechanism that's being used to mobilize the Human Service Center crisis teams. And so I'm telling you so much for the one question you asked, but I hope it has some relevance.
Absolutely.
Because the other thing we're thinking about one of the conversations that we have had in our steering committees is that from a national best practice standpoint, 988 is really critical part of the continuum, but in-person mobilization is extremely important to youth and family-based crisis, right? And I think that that's going to be a really significant system and cultural shift, right? If we're not screening out, how do we screen in, right? And what sounds like an argument about homework, or repeated runaway, or what we have traditionally thought of as unsafe, delinquent, high-risk behavior. These are indications of unmet need, right? And we really need to outreach and develop trust, redevelop trust. And I think that that's going to take a lot of time, right? Like I think it's going to take a lot of time for 988 to be well trusted, even though we know and understand and getting to know 988 and the people that work there are incredible. But why would I call 988, right? And I think that that's a question for us to think about, especially on the family side. So I hope that we can sustain partial hospitalization. Partial hospitalization from a reimbursement standpoint has a lot of built-in sustainability, and we know that the need is there. And it's billable, right? It's a billable service
Right.
that has that level of medical necessity. I've heard other partials have closed due to staffing
Right.
and space challenges and so on. So we'll have to wait and see. But I'll make sure you know, Vicky, they're going to have like an open house so you can view the space and meet staff and stuff like that. I think it would be great to have you present for that and maybe even bring through families if you think that that would be good. So sorry, that
Yeah.
was a lot. If you have questions or I'm really
Oh,
open to feedback too.
yeah, no, it was great. I actually did give them a call because I run into places before they're open. I'm just like, hey, what's going on here? Let me see. So I appreciate that. And I appreciate your answers. I like hearing about wraparound. The families that I work with, it's probably not the always just the youth or child in crisis. It's the whole family, siblings and everything. So, I mean, I think it's always good to know. I've been on a couple of the trainings for 988 and other things. I just hope it expands. And Emily, if nobody else can ask a question, I'm going to ask you a quick question too. Can you tell me, as a lived experience parent, was there one thing that stuck out to you that helped you? Or is there one thing you've learned since that crisis that you would want to see North Dakota have? Besides Dallas, because we have her and we know her and we love her, and her staff. But is there something that you think that could help a family, as for you or another family that you know, that is just not quite there yet? Like we don't have it yet.
Um, I think for me personally, the biggest thing has been having informal support. And for us, that's looked like access to second set of hands through developmental disabilities. Um, and I can confidently say that the reason that we didn't have to escalate to, we would have called law enforcement, because I didn't know about 988. I can confidently say that had we not had second set of hands like in our home or people that we could call on to be there immediately, um, it would like shielded us from needing to access that. Um, and I think a lot of families don't have that. And so I tell Katie this all the time that I feel guilty that we have services for our kids when I know that a lot of people don't. Um, that to me has been the biggest sustainability for our whole family's success. Um, I don't know if that answers your question.
It
Um,
does.
okay. And while we were talking about it, it brought up a question for me that even though I've heard you talk to Alice a couple of times and have been a part of conversations related to 988, what triggers mobilization when a family, because I'm thinking some of our crises have been in moving vehicles, when I haven't been able to stop, and I know that happens to other families, and I think what happens sometimes is when you're in crisis, you're like, I need someone now, so I'm going to call law enforcement because I know law enforcement's going to come. So if a family is in a place where, based on that they know their child, right, that like they do need somebody, what what is the mechanism to, like, when if they do call 988, how do they how do you determine mobilization? Like, is it a family saying we need somebody here right now? Like, what does that look like?
Yeah, that's a really good question. Like everything, it's kind of a case by case basis, of course. I don't want to make any like generalizations, but like if somebody says like I need like immediate supports now, we'll explore options. So we'll explore mobile crisis, or like there are times where law enforcement might be more appropriate depending on the situation, but we try to like focus on mobile crisis options. So if somebody says like I need somebody to be with me now, I can't do this like over the phone, like I need in-person stabilization. From there, we will either conference to the on-call or conference directly to the Human Service Center, depending on hours and everything. Otherwise, we'll just explore what's going on with the situation. And so if it seems like talking over the phone is not going to be beneficial for the situation, and like having that in-person support would be more beneficial for the individuals involved, then we'll offer it. So if somebody doesn't know that that is an option and doesn't know to bring that up, we'll listen and then we'll bring that to the table and provide that as an option.
Absolutely.
I have one thing to maybe ask or say, but I know we're rounding out the hour. I think what feels important for you all to know is that we want and need to make the system better. And I think a part of that is the development of relationship and trust. And I think that that comes from formal and informing education and connections with people like Dallas and others. But I do think for you all that are doing, whether you're serving parents directly as peers or just an interested parent and caregiver, is to know that there is a lot of effort and mechanisms that we're trying to develop to make sure that your lived and living experience is being heard and directs systems change. I think oftentimes we've seen not resistance, right? But it's hard to provide feedback, especially when you have faced adversity in this system and not always felt as though you've had positive and safe relationships with professionals. And so that would be something that I just want to leave on, is that Emily and myself, if you're open, or would love to just keep lines of communication open with you all at Family Voices, and for other family leaders and peers and advocates, just to make sure that we're creating these opportunities and mechanisms to communicate and learn from FirstLink, provide feedback to these providers because they need them and they desire them, and I think we all want to make things better. And yeah, I just want to say a special thank you to you, Deneen, for all of the work that you do, and also having us here tonight. And we certainly can make ourselves available at any time to do further education or even just discussing one-on-one, whatever you guys think would be best. So,
Katie, one question is the group from Connecticut, when are they coming? April?
Oh, yes. So University of Connecticut is helping to host a parent caregiver peer support training. So they have a workforce development model for parent peers called Pearls, and they're coming April 1st to 3rd. The training is full. We filled 26 spots, but we're hopeful to have some future trainings in July and later this year as well. So that would be a great option. I know Family Voices has a lot of mechanisms to train parent leaders as well, but this is our effort at the state level to really formalize training and certification with the goal of creating reimbursement structures and things that could help sustain parent, peer, and parent leadership work. So not to take away from what anyone else is doing, hopefully there are ways for us to align that. So anything I missed with that, Emily?
Covered it.
I think it's great that they're coming, so kudos
do
to you for getting
Yeah.
them here.
Yeah.
Any other questions from anybody? Joan, Jody, Vicky?
No, Dallas, I've got 988 to all my parents that I
Awesome.
talk to. even when I know that there's probably, at the moment there's not a crisis, but I know there's some things going on, I do try to remind them all that 988 is there. And you know, as much as much as it started, it's still people will ask me, really, what is 988? And I'm like, oh, isn't that sad? Go to Kirkwood Mall, they got 988 everywhere. I love it.
Hmm.
But there are a lot of people that still do not know about 988. So,
Yeah, that's awesome that you're sharing it, even in those situations where like there hasn't necessarily been a crisis presenting yet, because you never know when a behavioral health crisis is going to happen. It can happen to anybody at any time, and so I'm glad that you're sharing it with everybody.
yeah, I mean, I do because sometimes I get the calls and the crisis has already happened, right?
Mm.
And then we're talking about something and I go, well, I'm glad that you can call me and we can talk as well. But, in those moments of time, there is 988. I mean, they're there. But I also learned a lot from your PowerPoint, so I appreciate that more than I knew before.
Great, Vicky. All right, well, if there are no other questions, we'll end for tonight. And I want to thank you three ladies for some awesome information. So what we're going to do is everybody that registered will get the recording. And then for you three ladies, I'll send you the registration list too, so that you can also follow up with them and if you need to. So without further ado, thank you, everybody. And thank you so much for coming tonight.
Thanks. Have a good night, everybody.
Thank you. That was
You.
great.
Bye.
Thanks.